everyone. Good morning. I'm still on San Francisco time, so it's nighttime for me. Thank you, everybody, for coming. Thanks for the invitation. I think we have an interesting conversation ahead of us. I think we can make this a little bit less kind of like a little bit less formal. I'm Kwame. With me, I have Andy and Elizabeth. I'll pass on the microphone so you can really introduce yourselves. We have plenty of time. What I'd really like to get at the end of these 27 minutes, they tell us, is a better understanding of the fact that we are broadcasting all these signals through our bodies, and they become the substrate for this new intelligence layer that these amazing founders are working on top of. And I want you to listen deeply and carefully at what they're doing, because it has a real impact into where we're going in terms of understanding our own bodies and ultimately our own behavior. Okay? Shall we start with some quick intros? Elizabeth.
Fantastic. Okay, good morning. Thanks for the invitation. Nice to be here. So let me explain what we do. And because for sure what we want is to discover something, not to add value into this healthcare intelligence. The point is that nowadays there's a big problem, because most of the healthcare decisions is taken just by using a few snapshots of the patient, So now the patients go to the physician maybe once, twice, per year, depending on the chronicity, But the problem is that the biology inside their body, it's incontinuous, So we need to know better what happens between visits, So this is why in Ona Labs we strongly believe that we could monitor in another way, So for that reason, we have started to develop a technology that we have been working for more than 15 years in order to decode the sweat as a new biofluid, Because we understand that the sweat is a biofluid that can allow us to monitor in real time, in continuous, different metabolites, electrolytes, a lot of information in order to know in continuous what happens at the patients, not just during the visit, if not during, all the entire life, So this is the reason that we exist at Ona Labs.
Okay, sweat. Do you, just a quick follow-up on that, like, we all sweat. Do we all sweat all the time? Do you need... It's a fair question.
Yeah, absolutely.
Do you need to do a few push-ups before you get the...
Yeah, this is the question, because we started, and I told her before, that we have two business units, We have started with the sport, because at the end, the athletes sweat, It's more easy. But for sure, all of us are sweating right now, And what we need is very, very small quantity of sweat, So now we could be able to monitor the patients in a sedentary way, so it's not needing to, to put exercise in order to generate sweat. It's something that we have managed a lot and that we have studied a lot, this biofluid, and how to extract this quantity.
Okay. Andy, we're kind of staying in the realm of the biggest organ that we have in our bodies, right, with you. But you take a different angle. It's not so much about sweat. It's about identifying a number of conditions. I read 300 plus conditions. Your skin is very much like a printer for your inner health in many ways, and you're able to read that.
Yeah.
Elaborate.
Yeah. Well, I don't know if some of you have been to the dermatologist in the last month or tried to get to a dermatologist, because there is a waiting list that is like, I don't know, maybe more than 6 months. It's really, really, really a long time. And so this is the problem, because we don't have enough dermatologists. This is a global problem. But here in Spain, in some community, the waiting list is almost a year in the public sector. So if you go to the public sector, you have to go to the general practitioner. And the general practitioner is not an expert of any of the disease, of any specialty. So what we're trying to do is help the general practitioner to help people with dermatology conditions to get the diagnosis at the beginning, so they don't have to wait to get to the specialist. So what we do is artificial intelligence algorithm that help in the diagnosis of the diseases, but also in the severity measure. So what we provide to the specialist is not only what the patient have, but also how severe is the disease. In this way, we are helping with the treatment, not only the diagnosis, and the follow-up of the patient.
Okay. You are FDA regulated. It's medical grade.
It's a medical device.
It's a medical device,
yeah.
Right? So it's serious in terms of the certifications that you have to undergo. Has that been a barrier for you, or is it really an enabler?
It's a barrier at the beginning, because you can enter to the hospitals if you're not regulated. Mm-hmm. But I think it's also a positive way to enter, because you're going to get access to patients' data. You're going to affect people's life. So you need to be regulated.
Yeah,
it is
sure.
really important.
Okay. That's where I want to get. I want to get to start to paint a picture of there's all this data. And Elizabeth, in your case, it's probably less regulated, your space?
No, it depends on.
Okay.
So as we have two different business units, for the sport, absolutely, yes, it's less regulated, so it's non-regulated market, so it's not needed pass any notified body and so on. But we set up the company with a mindset to be a medical company, so this is why we also are working with different devices, wearables that monitor vital signs in real time, also glucose for diabetes, and this is a space that we need to be regulated, yeah. So we have both.
Okay. In terms of, I was told I will speak a little bit about what we do as well. So I'm the founder of this company called Synthetic Users. We're above the biological substrate, so what we do is we predict human behavior. Basically, the idea is if you want to create new products, you always need to talk to people. We synthesize people so that you can accelerate that process. So in the US, for example, you have a number of companies that use us to predict like jury outcomes, guilty, not guilty, 12 people, are they going to, what are they going to do? And so for us, we work in this kind of behavior layer, not so much the biological layer. We obviously take on board as much data as we can, and we try and find that correlation towards behavior. But that's why I'm in this panel talking to you, because ultimately we're talking about human data and where that is going. So from the perspective of what you can actually read and what you can predict, can you talk a little bit about that? Because there is one thing is, yes, I can read your signals. The other is, okay, you are, your life expectancy is severely going to be tested by this particular signal, or you're going to have to change your behavior in meaningful ways because of that other signal. Can you speak a little bit about how far can you predict, really?
Yeah, so this is a fantastic question. I think, my opinion, yeah, I think it's nowadays we are still, unfortunately, far away to do the real prediction, yeah, because of this thing that you have connected. So at the end is to have a real prediction, you need a lot of quantity of data, but quality of data. So it's a must to have a longitudinal data. So not only just one punctual or one snapshot, and so you need a lot of data with enough rigorosity. So I think nowadays the prediction is more connected with to have an early detection than really a prediction. And even more for me, my consideration is at the end is our goal is to be far away and not the prediction is just a tool. The goal is the prevention, At the end, this is, because what we want is not solve one problem. What we want is to avoid this problem, So this is the goal, and I think that we need to make some complementarities with different technologies and cooperate in order to bring more data to the patient, quality data to the patient in order to do real prediction and even more prevention.
And how do you, just double clicking on that, how do you, so you're just relying on your data, or how are you looking at this whole kind of large language model space that's been trained on everything out there? Are you using data that is not necessarily yours, and therefore you are not quite sure about longitudinally how deep you can go? Or is it just like we're taking our data points and we're gathering those and we're relying on our data?
Yeah, this is fantastic. And I think it is a challenge that the healthcare system has right now, because at the end, when you pass the regulatory pathway and the notified body, you certify your own data. And that's fantastic because it's what you work. But at the end, the physician and finally the patient is going to use the final amount of data, not just one. So for sure, what we certified is our data, our vital signs and our sweat data. But at the end is it's a must also to certify or verify that you can add more other data in a longitudinal way, and add more value, But it's not any requirement for that,
Okay, Andy, on your side, how much can you predict? How far into the future?
I think what you say is key. The important thing is not the prediction, but the preventive side. But I think that applies in the prediction of a disease, but not in the prediction of treatment. I think we can work a lot in the prediction of treatment, because I don't know, the same treatment doesn't work the same in all people. So we need to evaluate all the data from a patient, which treatment we want to apply, what is the quantity of that treatment also affecting or making good results in people's lives. So I think we are working on that in Late Health, not only in the diagnosis, but also in the prediction of the treatment we are applying to the patients. But it requires a lot of data.
Okay.
So it is important to get a lot of data. So it's going to be hard work.
One thing that's kind of been nagging at me, being in California, you have all these startups where, every 10 minutes you can scan your body, and they tell you suddenly that you have like 30 tumors and something that's like weird in your knee, and you're like, okay, what is that? My stress levels usually go up after one of those body scans, like full body MRI. It really got me thinking how healthy is that, right? How healthy is all that data all the time, right? And it's something right now we're in the midst of this kind of data revolution and what we do with all this data. I think what you said I found interesting, which is, there's detection, diagnosis, but then what treatment and who makes that decision? Right, to move forward? Do you give it to the patient, like the decision is yours? Is it mediated by a doctor? Should it be mediated by a doctor? How do you make that? How do you have that conversation?
I think it should be mediated by the doctor.
Always.
Yeah, well, the treatment it is a chronic disease. The treatment is not for consumer to decide what treatment to get. So yeah.
Okay. Cool. All right.
It should be informed treatment, so you have to give all the information to the patients to accept that treatment, but it should be a medical diagnosis and recommendation.
All right.
Yeah, I think to add just, if you are in the medical field, for sure, not a physician should be the ones we have, who has the data and who analyze it. But for us, it's also important that, because, for example, we developed this as a black box without any display in order to not stress the patient. Yeah, this is one of the recommendations also that belongs from the physicians. Yeah, but I have another perspective, yeah, another vision that at the end is, we are human and we are quite intelligent, no? And maybe we can get more information about the body. At the end, we can manage the daily life because we can change, no? Okay, which is your routine. You can decrease the stress, you can eat better, you can do more exercise, and if you don't have this information about your body, you cannot make actions, you know? It's just like a reaction that, okay, depends on my physician, what he said, what she said. But I think it's a must also to be involved, no?
But it
without
means like
no stress.
lifestyle. You have to improve your lifestyle, but not drugs.
No, for sure, absolutely. So not for auto prescription, self-prescription.
That's right.
No, yeah, absolutely, yeah.
Okay, yeah, I'm still a little in two minds. So the space I inhabit is one where we're trying to predict human behavior. And at some point, right now we can predict what small groups of people are going to do. At some point, we'll be able to predict what a city or how a city will vote, how a country will vote. We'll be able to predict elections. And so with all of this predictive power comes quite a lot of responsibility. So my question still stands. Where do you put that? Is it who ultimately has the decision power here? And I think a lot of that conversation will revolve around also who owns this data, right? So you are relying on a lot of data that your technologies are able to gather, right? Can you speak a little bit about, who owns this data? How do you think that's going to evolve over time? Do you think right now it's the user plus the hospital? And over time, it will just be the user, or will it kind of go on to the insurance company, or into, like the data chain is actually quite complex here. Can you speak a little bit about it? How do you see that data ownership piece?
Well, I think at least in Europe, the law is really clear about this. The GDPR says that your data is yours. I think the problem is that not all the people knows that. It's not really aware of what we're giving to consumer apps, for example, not only in the medical field. So I think it's important to all the people who gave their data, it's really informed about what they're giving, because who controls your data is going to control your health. So this is really important to know.
Okay, that was very succinct. Elizabeth?
No, yeah, absolutely. So the data belongs on the patient for sure, no? And this is what the regulatory says, and absolutely 100% agree on that. But the point is that I think that it's a must to cooperate more, and to show to the patients and the final users and all the different stakeholders that the value, it's not the ownership of the data, if not the exchange value, because at the end is the patients need to know, and it's a must for us, no? And a need to explain very well what happens with the data, no? What, why, when, who is going, which is the value, which is the benefit to share this data, because at the end is self-benefit, If we share the data, following all the compliance and so on, at the end, we can generate, with all the artificial intelligence and the machines and tools that we have right now, generate more value and more benefits, And I think this is one of the clues.
Yeah, and I think people is willing to give their data because it's to improve their lives. Yeah. But they should know what people are going to do with their data. So,
yeah, absolutely. So there's a must also a transparency and a trust, And we need to work on to check this.
Yeah, totally.
Absolutely.
Yeah, I'm the American in the room, so it's.
Well, you can explain in the American view.
Yeah, well, the American view is well, it feels a bit like a different world out there. You ask for you don't ask for permission, you ask for forgiveness.
Yeah.
Right? You get stuff done, and then it's like, ooh, this is actually interesting. And you're seeing that in the whole regulatory framework around AI. The US are being very liberal about it because they don't really want to constrain any movement right now, especially in the period where we are, which is in its infancy. It feels like 1997, like just before the whole internet boom. So my take is less regulation to begin with, and then when we become a little bit more aware of where we're going, then by all means, bring in the regulators.
Yeah. I think it should be like a mix of both, because we need to regulate it. I totally think that is important, but the restriction of the regulation, how difficult it is to be regulated and to get access to that data, I think we should improve that, because we can see that in the US, the technology is more advanced because of this reason. So yeah.
Yeah. That and a whole bunch of other reasons. As business owners, I assume you're business owners, right? What are your biggest challenges right now? We have, potentially interesting audience here. What would you ask? Like, what do you need? Where are you in your business journey? Where are your biggest challenges right now?
I think our biggest challenge right now is market entry because of regulation.
Okay.
Yeah.
Come to the US.
We are getting over that. But the regulation is really difficult to get. So we're investing a lot of that.
Okay. So, but what does that mean in practice? Like, you have to hire more lawyers? You have to start, what's the...
Lawyers, consultants, clinical validation in the market we want to enter.
Okay.
So,
Okay. Elizabeth?
Well, for me, for sure, it's a big challenge, the regulatory here in Europe, but it's not depends. The big challenge is just you don't know the timelines of the regulatory pathway, So, and this is critical point for startups, But for me, there's a lot of big challenges, not that the regulatory and also funds, but for example, in the market entry, that we, for example, in Nona Labs, that we have developed a technology that's monitoring continuously in real time. The thing is that the healthcare system still is yet not prepared for that, So it's not, we need to be aligned with all the stakeholders.
Not market entry, but market adoption.
So we generate a lot of data, but we need to convert this data to useful data, and the system is not ready yet to get this information and apply for the physicians, for the hospital, for the different players. And this is a big challenge.
And I think it's not because of the regulation. It's because they don't understand the regulation, so they don't know how to advance in that matter.
Yeah, that feels more like an integration issue. Like, not everybody's running at the same speed, and
Totally.
We have 3 minutes and 39 seconds. Do you guys have any questions for this wonderful panel? No? No questions? No questions?
So we can leave.
Do you have any parting words, Elizabeth and Andy?
I think there is a question.
Oh, there's a question. Amazing.
Thank you so much for the amazing discussion. My question is more related to how do you see the landscape of data points evolving? For example, we have more devices that are measuring our metrics. How do you see that evolving, and how that can relate to our lifestyle and maybe robotics in the future? Thank you so much.
So how I vision it at the end is we have a very huge opportunity here, and as you said, we have a lot of wearables that we can monitor right time, the different physical parameters, the surface of our body. I think that we have a huge opportunity in the future not to get with a lot of wearables and so on, but get more informed, about our body. Yeah, and for sure, as I said before, it's going to affect our real lifestyle, yeah? Because at the end, we need to anticipate. We need to know better about our body, and I think it's a fantastic opportunity to get this technology in order to empower patients, empower citizens, empower all the users to create a better, healthy life.
Yes, for
population.
Yeah.
Absolutely.
You have to
it's
when to
100%.
move, when to stop.
Yeah.
It's really important.
Yeah.
So the goal here, the goal is longevity.
Yeah.
Is the goal longevity? Is the goal, or is the goal something else? Because, like I said, with a lot of data, to your question, comes also a level of stress, right? A level you mentioned, like, okay, I have one wearable, suddenly I have two wearables. My shoes are telling me to move because I haven't moved yet, and at some point we must strike some sort of a balance. And when are we near that, or are we still quite far away from that, according to the world you want?
Yeah, I think it's a must to be prepared. I think now the most of people are not prepared, because just for the word longevity, if we look longevity, okay, this is not for me. So it's not live more, if not just live well, yeah. So we need to make a lot of training, and better understanding about the use of this technology, about the use of this data. Do not stress a lot. Finally, and at the end, is going to help the country get the country. Yes.
Andy, you get the final word.
I think it's not only to get to live more, but it's to get to live better the way you are living right now. So it's really tricky. I think all the good things also have bad things. So it is a mix. You have to control. You want to get access to data. You want to be informed. So you need to be aware that information can get stressed. So.
All right. And with that, thank you so much, everyone.
Okay.